it is quite surprising for those of us in the healthcare industry when people are actually shocked when we say we are in as bad a situation as any other industry.
Thank you all for joining us here today. It's a big privilege and a big pleasure to reconnect with everyone, our distinguished panelists who have also joined us previously offline, speakers and attendees for our events. And thank you to our distinguished audience for joining us as well. We've received over 160 registrations and over 150 of them are CEOs and CXOs, so thank you so much. In response to this COVID challenge, the Blue Circle also has accentuated its digital presence. One of the modes we will employ is our webinar series. We're also building an expert pool to support the industry so that they can be their guiding lights. So I deeply once again thank our distinguished speakers, our attendees and leaders for joining us today. So now in the best interest of time, I will just quickly mention the most relevant designations of the panelists. We have with us Public Intellectual Mr. Pavan Choudary, who is also the MD of Vygon India. We have well-known healthcare experts, Dr. Harsh Mahajan, Founder and Chief Radiologist, Mahajan Imaging, Mr. Gautam Khanna, CEO Hinduja Hospital, Mr. Navneet Bali, Director Northern Region at Narayana Health, Mr. Tony Parmar, MD and CEO Albert David, and one of the most prominent voices in the healthcare PE space, Mr. Sunil Thakur, Managing Director Quadria Capital. So welcome everybody. Also kindly note, we will have 2 rounds of Q&As with the audience during this webinar. Now I request Mr. Choudary to please begin the session, sir.
So thank you very much, Siddharth, and welcome to this distinguished panelist. So in our last webinar, we spoke of what can be the blessing which can be born after this curse is over. COVID surely is a curse and it's a big upheaval. However, upheavals in the past have also spawned opportunities. So in the last webinar, we took a deep dive into which are the sectors which would decline and which are the sectors which would rise because of this big upheaval. We also saw that the curse of pestilence will not have uniform effect on every sector, every subsector, sorry. So the staircase of COVID knowledge, we realized, is deeply congested. Lot of information on the staircase of COVID knowledge. The idea is to prepare with the help of this distinguished panel, the next step on COVID knowledge. So this is the idea, and which is where now I would like to straight away come to the context of the various industries which are represented today, and then pull in the panelists. So the pharma industry is very close to us in the sense that even if we have not got an injection ever in our lives, we have surely got some pills, some cough syrups. So looking at the pharma industry, we see the logistics has been hit very badly. The demand curves have been mauled. And this situation is similar to the medical technology industry, the medical device industry, and a little similar to also the imaging industry. And I will bring in the panelists on this. The hospital sector has seen a sea change. Already there were some comorbidities. Price control had come, so that was one hit. Then medical tourists were already falling as the news of COVID was spreading in December and January. They their footfalls have come to nearly zero. Elective surgeries, the advisory came against holding elective surgeries. So the elective surgeries have also reduced to nearly zero. Demand curve changes have come. Therapeutic modalities of COVID itself are seeing changes every day. Someday masks are necessary, someday they are not. Someday ventilators are necessary, someday some other group comes and says it should be CPAP. Bottom line issues are there. Personal and moral issues are there. Yesterday only we heard of this extreme unfortunate incident that a doctor who died because of COVID, he did not get a proper funeral also. We have heard from other doctor friends that nurses are being questioned by landlords as to why they are living here if they are in contact with the COVID patient. Doctors who are living in colonies who look after COVID patients are being questioned by the RWAs. So society also requires a lot of education. Then patient care issues are here. We are also in touch with the European Society of Intensive Care Medicine. Patients also, families in many cases had to stay away from the patient, whereas a nurse held the patient's hand as he was dying from COVID. So, sea change. Let me start with this sector only. Let me first pull in Gautam and Navneet Bali, where this sea change has happened, and let us ask them to further train the spotlight on whatever difficulties they are encountering, where they expect this to be going, and what can be then the opportunities and threats in the business ecosystem of hospitals. Gautam.
Thank you, Pavan, and to all panelists and the audience, good afternoon. I want to just start by reading out an advisory which talks about social distancing, upgrading of health infrastructure, sharing of doctors and nurses across hospitals, closures, lockdowns, uh, development of vaccines, development of rapid test required, educational material, and some conflict in clear authority between public health officials, and masks to be worn. So you would wonder why I'm saying this advisory, because it's known to everybody. Because this was exactly the same advisory in 1918. So the history has repeated itself. So there is nothing new. Same thing and same conflicts appear then and they have appeared now. So why did it happen? Because we should have known, we should have learned, and we had a SARS in 2008. So what was the lesson from there? The issue is, at that time, the pandemic happened because of lack of health preparedness. There were a lot of attitudinal issues. Means access was not proper. There was a feeling that if I isolate myself, I will be okay. There's a lot of distrust. So if you think about it, same things are evident today. So if you just say, did we learn any lessons? Yes, we did. We learned to put a mask in 1918, but we gave it up in 1919. So that is something to be learned for society, for us now, that what is the lesson we learned. But coming back to the challenges of hospitals, if I can say, Pavan just mentioned about the congested stairway of knowledge. We in couple of weeks we have had to focus on developing new infrastructure on isolation beds, isolation wards, new protocols, screening, triage, procurement, and somebody mentioned about panic procurement, construction in times of lockdown. Then how do you ensure employee presence in the times of quarantine, when there's no transport available, when the morale is down? You need to do some counseling. And then how do you ensure the patients and employees' physical health and mental health is taken care of? For example, we put a counselor in addition to a physical health, mental counseling for all patients and staff. And the other thing in this is communication with all stakeholders became very, very important in the last few weeks, including PR management, adherence to government guidelines, and so on, and about who gets the chloroquine, who doesn't get the chloroquine. So those are all very short-term measures which all the hospitals have come out, and they've been dealing with the challenges. But let me just say that this will get over. Now we are moving to the medium-term horizon. So medium-term horizon is a little different. In medium term, I think the issue is more on financial sustainability. There was a study by FICCI and ENY which said that hospitals are losing around 7,500 crores a month. So if you say 3 months, you're talking about more than 20,000 crores, and you can multiply. So there is an issue about sustainability. Some will close, some will sustain. And then how do we manage regular patients? What do we do in the future about our leadership style? Because leadership style moved to directive during the crisis. Now it is different. And then what do we do in the long term? So what is the lesson in the long term? So I think the lesson which I see for myself, I think there is a role of new technology. There are new social customs. There has to be more focus on public health and e-reporting of the results. We've already seen guidelines on video consult have come, so which is a new way of consultation. EICUs, use of robotics, use of robots, and portable digital equipments, and social media is being used more and more like we are using today. And simple things like putting a UV light for the cash which is collected in the hospital so that the cash is not infected and does not contaminate our other patients. And of course, developing all kinds of infection protocol and SOPs. So I think the focus will be on prevention, and I think a good lesson from this virus pandemic will be if we start focusing on health as the most important thing and develop our infrastructure to deal with that. Let me stop here.
Great points, Gautam. So let me take the question now to Navneet. And the tail of the answer, you spoke about, or in the beginning of the answer, you spoke about how the situation is similar. And I was also reminded of one more similarity, that nurses got a very prominent role after 1918, because doctors stayed away. They were stayed a little more away from the patients than the nurses. Adult suffrage movement for the woman was coming in, and both these things, their critical role during the Spanish flu as well the adult suffrage movement, tilted the balance of power a little in favor of the nurses, which they again lost. But in the time to come, Navneet, do you feel that there might be some changes, enduring changes in the healthcare worker space? This is one question. And the other question is that you handle hospitals of different types. Are you seeing scenarios which are different in different specialities? Please begin with that.
Thank you very much. At the outset, thank you so much to the Blue Circle for inviting us here today, and special thanks to all the attendees who have taken out their time to listen to all of us. Really indebted to all of you. So I'll just take away from where Gautam has left and where you started. And 165 CE was the first epidemic or pandemic that was the Antonine Plague, and it killed 5 million people. And from then to till date, the world has seen 20 pandemics. And the last 10 years, we have seen 5 of them, one after another. So, I think there are enough lessons that we have learned. There is no dearth of what we should be doing and what we should not be doing. So that is no doubt about it that we have been much wiser. Did we actually put those learnings into practice? I think many of them, the answers would be no. And that's why we are seeing such a response right now. Coming to your second question first, Pavan, that's about looking at responses of different hospitals, different specialities in different locations. I think if you really have been following the media and you have been seeing across the world also, I think different doctors and different hospitals and different governments have responded differently. Let's come down to our own country here, and let's come down to the three hospitals that I had. One is a cancer hospital. The second is a multi-specialty. The cancer hospital also is multi-specialty now, Dharamshila. The other one is again a multi-specialty. And third one is in a place called Katra, which is far in Jammu Kashmir. So there is a paradigm difference in the way doctors and nurses and the staff are dealing with this situation. A cancer hospital, typically the entire set of healthcare workers are very, very inclined to treat those patients because they empathize with the cancer patients. They see that those treatments cannot be postponed. Those patients require, day-to-day, treatments and day-to-day consultations, etc., etc. And so I would put it as if one specialty, one particular specialty, which is oncology, has been in great focus as far as the behavioral response of the healthcare society is concerned, and they've been very, very empathetic towards it. And how it pans out in the future, it is for us to have a look at it, because we've been seeing cancer cases on rise in the past. And coming to a small place like Katra, which is a hospital which is co-located residential area, I think the healthcare workers are very, very afraid, because they feel that they could carry that infection back to their homes and pass it on to their elder parents, children, etc., etc. That is the second kind of response, and it was more exaggerated when we did not have the PPEs and we did not have the protective equipment. As the market started getting flooded and we had more and more of PPEs coming into the hospitals, this fear has now started slightly weaning off, but still there is a great amount of difference in which how different hospitals which have different specialities as their core have responded to this infection. Coming to your first question about the healthcare workers, I think it's a very, very pertinent point, Pavan, because across the world in many of these developed countries, but not going by that we should follow the examples. I think India has done much better than many of these countries. But many of their nursing staff, many of their technologists, many of their not doctor healthcare workers have great amount of freedom and great amount of opportunities to do many more things that in India only doctors do. And this has been vehemently recommended by Dr. Shetty in many of his interactions with the government. And we have been talking about it for a great amount of time now, is to empower the healthcare workers in addition to the doctors. And you realize that many of these countries, doctors are the ones who got overwhelmed, because there are few number of doctors, and few of those doctors are actually treating the critical patients who are on ventilators, etc. So let us say you had senior nurses or paramedics who could, take this load off, the doctors. I think the situation would have been slightly better. So as of now, I think these are my two little bit towards what you asked. And as the panel discussion progresses, I will pitch in a little bit more. Thank you.
Very good. I think excellent point which you made. And so there is chaos in the society, in the market today. And for business, chaos is often a ladder. But who will ascend the ladder? Which tribes will now ascend the ladder? So far, the provider space or the hospital space was ascended by doctors. Doctors became entrepreneurs. In times to come, it is possible that other breeds of healthcare workers also become entrepreneurs or take advantage of the situation, or get let me say, get more power in the system, get more things to do in the system. I remember in UK for many a time the surgeons were coming from a class of barbers, which is why surgeons were not allowed to write doctor, because they were actually barbers. They used to come and give the nick and the cut. But eventually they specialized, they formed a body of knowledge, and they rallied out. They became more and more powerful. And today they are among the most powerful lobbies in the world, surgeon lobbies. And now they still don't write doctor in UK because they feel they are higher than the regular physician. So, and that also happened around upheavals when things like that were happening. So coming to coming to Tony. Tony, you bring the pharma sector into the spotlight. What is happening in your sector, in the logistics space, in the demand curve space, and where do you think the COVID crisis is finally going, and what opportunities and threats are emerging?
Yeah, thank you, Pavan. Very good afternoon to everyone. And I only hope everyone in your family, friends, and colleagues are happy and healthy. Coming to the pharma industry, I must first qualify that pharma industry and the healthcare professionals are also human beings made of flesh and blood. And the industry itself is like any other industry of the economy. So we have also not been insulated or immunized from this COVID attack, unlike what many seem to believe. So we have also felt the initial brunt. It's just that we understand this epidemic or pandemic a little better. So probably we are a little better prepared to face the pandemic. Coming to the pandemic, there's one major difference between any other enemy and this virus. The COVID-19 virus is an invisible, monstrous enemy. And that is a problem because human psyche believes and fears what they can see. And this virus is an invisible enemy and a very strong enemy at that. And that is where I think we lost some initial time. It took people time to realize the impact and the seriousness and the danger of this virus. And the countries which reacted soon have seemingly seen a flatter curve as far as the increase in number of COVID cases are concerned. And I'm happy to see that India and the Indian government also reacted and acted pretty early. There were initial reactions by people who said, have we overreacted? At least people who asked me, and having a little better knowledge about these pandemics, my response to them was very clear. It's better to err on the side of overreaction than not getting a chance to even act, because once we go into stage 3 and the community spread, there's nothing that you can do other than just pray that your patient immunity takes care. Now coming to the pharma industry, did we get enough time to prepare for this lockdown and the consequences? No, because the announcement came suddenly on 24th midnight. And we in the pharma industry are a serial process industry. Start with the raw material, packaging material, go on to the manufacturing, warehouse, down to the depots, stockists, and the chemists. So any roadblock or a bottleneck at any one of these stages causes a efficiency issue. Because in a serial process, your overall efficiency is as good as your slowest step. Now what happened? When demonetization and GST came in, there was an overhauling of the overall supply chain and the inventory levels of the pharma industry. Earlier, there used to be good inventory, close to 20-30 days at the stockist level, close to 15 days at the retail level. The overall inventory levels from more than 30 to 40 days has come down to 20 days. And therefore, the chances of errors or inefficiency in the supply chain has minimized after the demonetization and the GST impact. And now came this lockdown with no notice, and suddenly there's no transportation. The manufacturing, though under essential services, was subdued because the workers could not reach your manufacturing place. Raw materials could not reach. Essential services were open, but the non-essential supply services, which eventually opened, initially 10 to 15 days was a problem. So in the first 2 to 3 weeks, there has been a bottlenecking of supply chain, also at the manufacturing level, but more at the transportation level. Hopefully from yesterday, 20th, when a more relaxed kind of environment is there, the drivers and the trucks would be on the road. The manufactured goods from the factories would reach the end point, last mile points of the stockists and the retailers, and hopefully we would see a much better situation. Healthcare industry, like one of our panelists said, is probably in a better position than many other industries, because I compare healthcare industry to that winner tortoise in the hare in the tortoise race. We will be consistent, we will remain healthy, while someone will race ahead, come back, but the tortoise of healthcare industry will continue because human beings and life expectancy will be there, and there will be diseases to treat, and there will be companies to create healthier human beings. More when we come to more questions. Thank you.
Great. Thank you very much, Tony. So now I come to Dr. Harsh Mahajan. Dr. Harsh Mahajan is not only a renowned professional, but he is also an entrepreneur. So what I would like to ask you is that during the Black Death, the entire power structure of the society changed, where the peasants became more powerful, there were lesser mouths to feed, so people could concentrate on not only grains but cash crops also. The banking practices from Italy and others spread through the cash crop trade to other countries, and there were a lot of, let me say, there were silver linings after the gloom. After the SARS crisis also, online shopping, for example, in China, it grew very fast. I would like to know from you, Dr. Harsh, 2 points. First is how the radiology industry has been affected. And I'm also clubbing that with a question about the IVD industry, which has come from one of our colleagues, how it has been affected. And where do you think the situation is pointing where there might be some opportunities also to tap?
Thank you very much, Pavan, and good afternoon, everyone. See, it is quite surprising for those of us in the healthcare industry when people are actually shocked when we say we are in as bad a situation as any other industry. Talking specifically of imaging and the pathology labs, the workload and consequently the daily collections are down by 90%. Our fixed costs remain more or less the same. And in labs, actually the fixed costs account for nearly 80-85% of all costs, and about 45% are just the salaries alone. There is a slight difference between the pathology labs and radiology and imaging, in that for imaging, a patient has to physically come to the department or to the center. So he has to physically be coming there, whereas in pathology, you can go to his home and take a sample. That's why you have these large chains which have 5,000 collection centers, and you just transport. Unfortunately, it's not possible to transport the patient. And that also there is this difference one needs to remember, and that will impact what happens as we go into the future. Even though it's the pathology labs and these 82 of those private labs and about 190 odd government labs, which are actually, in the face of things, trying to diagnose COVID, but the other tests have really fallen off. Most of the pathology labs, just as most of radiology diagnostic centers or centers which have a mix of both, most of them are closed currently, because what is the point in opening if you're going to have 5-7 patients walking in? Patients, one, because of the lockdown, two, because of the fact that unless it's an emergency, no one wants to go to a healthcare facility fearing that they may catch the virus rather than vice versa. So currently things are really bad. And somehow we managed to pay salaries for March, but for April, it's a struggle. How much can you borrow to pay money which will never be recouped? So across the industry, and this goes for the hospitals also. I may take a leaf out of Gautam and Navneet's book and say, even within hospitals, despite the government notifications at one time saying, don't admit anyone who's not emergency or COVID, to now trying to say that, okay, you may open some for surgeries, routine surgeries also. Work is down to about 15-20% maximum of what it used to be. Now, when we look at the scenario going ahead, see, this disease is not going to disappear with the lockdown. In fact, the fear is that it may make a resurgence after the lockdown. India currently is in a very, very good position when you compare with many other nations of the world, especially the Western. But we have only about 17,500 diagnosed cases. And if we say that there are 10 times more in the community which are asymptomatic, which haven't been diagnosed, we would still be at 1.7 lakhs. We have about 750 odd COVID hospitals, and most of them, thankfully, are nowhere near full capacity. They're mostly less than half. The ICUs are 10%, 15, 20% full in these COVID hospitals, except maybe in certain areas where there may have been spikes. But even in Delhi, as of yesterday, there were less than, I could count on one finger the number of people who were on a ventilator. So India is in a good position. But if we have to sustain that position, then the lockdown may be lifted, but it should be done only in a very gradual manner. Otherwise, we will descend into the kind of chaos that we are seeing in the West. And because it will be lifted in a very graded manner, and because of the fear attached to this disease, because of how contagious it is, because of the new knowledge that we are finding that this may also be present in the air, people are going to be very cautious. And so even if you say second quarter of this year, going on till September, I don't see a resurgence, and it may take even, January, February for us to reach somewhere near what we were pre-COVID. So things look pretty bleak. And for the healthcare industry, the double whammy is that we need to stay open. Because not only do we have to treat COVID, but we have to also treat the huge amount of non-COVID patients who in the past 1 month and more have been completely neglected. But these are all people, mostly with chronic diseases, also some with acute, but those with chronic diseases have more chance of having a severe illness and dying. So it's really a catch-22 situation, and unless our whole healthcare industry is looked at by the government, and as Gautam said, many will fold, and that's not good for this country, where already we have, a dearth of facilities. So, I'm trying to paint a realistic picture, not a gloomy picture. But this is as I see it, and many amongst the fraternity appear to concur with and so, when we see the list of industries affected by COVID-19, and we don't see the healthcare industry even coming number 20, it's very surprising. It should be somewhere at number 2 or 3, maybe below, the airline and tourism industry should be healthcare. How quickly the resurgence will happen? Will we need to reinvent ourselves? Definitely. We will need to do cross-cutting. We are currently the cheapest healthcare provider in the world. We will have to somehow find ways and means to go even lower. But for quality, there will still be some price to pay. And hopefully, in the private healthcare milieu, society will recognize that and still come back to those who stick to quality, who stick to standard SOPs, who stick to having PPEs and discarding them as per guidelines, and not do shortcuts, because shortcuts are only going to lead to resurgence of COVID. Even if we conquer it once, there'll be a second wave, there may be a third wave, God only knows. I'm not a fortune teller. but COVID is not going to go away in the short term, and a vaccine is at least 9 to 10 months away. So we have to wait that long.
So your realistic picture is very intimidating. In fact, just 15-20 minutes before we started, remember we were talking about the fact that we are getting, Siddharth is getting, getting requests from people if they should consider joining the healthcare industry at the senior levels. Now, if some of them are listening to what you have just said, they will think twice before following up on that request. Great point.
It's a tough.
It's a tough one.
I think.
It's a tough one. So coming to Sunil. Sunil, now looking at all these four sectors, you saw pharma, and medtech is very similar to pharma. You saw hospitals, you saw imaging and IVD, which is again quite similar to each other. Where would you like to place your bets? And I'm not saying which you would not like to touch, because that will make us kind of untouchable. Which of these sectors you feel is showing the earliest promise to attract investors? Sunil.
Thanks, Pavan, and good evening, everyone. To answer your question, while I completely agree with Dr. Mahajan of his views, and most people don't realize it. Most people think that you are in the healthcare sector and you guys must be making a lot of money, but there is significant amount of pain in the sector, and I just hope on the positive side. It should turn out to be blessings for people who deliver quality, who are very, very serious, because this is going to create a lot of havoc, and people who are sitting on the fringes, low quality, shallow service levels will move out. So in terms of how we look at the sector today, one thing is very clear, that amongst all the sectors, healthcare is one that will recover the quickest. And when we talk about healthcare, we look at the entire segment, right from services to products to technology and everything. And we have, that's the reason why we have panelists from all walks of healthcare. So we feel that the one sector that's going to emerge as a new order or the new attractive model are the ones who are going to harness this significant behavioral change that is coming in the society, and that is mainly driven by the need for access. Today, most of us feel that we need to have access. Even if we don't go to a hospital, we need to have access to healthcare delivery. Models that are going to harness behavioral change, the fact that we are now doing this kind of conference over a VC, and frankly speaking, we don't feel the need to be physically present to be discussing it. That's a big behavioral change. Models that are going to help in resource management, providers, products company, everybody is feeling the need for resource management, whichever way it comes about. Models that are going to offer convenience, sitting at home, you get all your stuff. Models that are going to cater to business continuity plans. Most providers, product companies today feel the need for business continuity plan in whichever form it comes about. Patient therapy continuity programs or models. Digital therapy is one. There are models which can manage some of these diseases through online models, are the ones that we feel, and then wellness. So these are those big models which we believe are going to become the new order, will attract significant amount of attention from investors. So that's my summary. In terms of how I look at the conventional traditional model, as Dr. Mahajan mentioned, that providers are having a tough time. We have quite a few hospitals and lab companies in our portfolio company across India, Southeast Asia. They are at the level that Dr. Mahajan, Navneet and Gautam mentioned, 15-20%. High quality hospitals, good talent, but because of the situation, and the situation will continue, as Dr. Mahajan said. Officially we may open up everything on 4th, but it's not that officially the virus is going away. So, this will stay on for another quarter or possibly more. As far as the products companies are concerned, there we are not seeing that kind of a pain. So if I look at providers or caregivers at 15-20%, manufacturing product companies are at about 35-40%. And frankly speaking, if the supply chain gets fixed, it can go up to 50%. As Tony mentioned, it's the components of supply chain which are not coming together. So you have laborers who are at 50%, 60% of the attendance in the plant, but because your warehouse is full and you don't have somebody to take the products out, you just can't produce. So products company I would feel would be relatively in a better position compared to providers, and there we are better off compared to what we need to do for the providers. So that's the way I would see of how what will be the new order and where the attraction would lie, and how I see the current conventional model faring in this kind of environment.
Great, superb point. In fact, what I think the whole panel has said is healthcare will recover. When it will recover depends on how deep a blow it gets. Right now, the blow has really paralyzed it, but still it can recover. If this blow will sustain for some time, then recovery will become that much more difficult as well as long term. The point which you made was that what companies to investment, what businesses will do well in healthcare will depend on how closely we monitor behavioral changes, because behavioral changes will determine the socio-economic grain of the society. And the socio-economic grain of the society will determine, socio-economic and cultural grain of the society will determine which businesses flourish. Whether it will be wellness, as you said, or a smaller hospitals or aseptic experiences, we do not know. But but right now the pointer is pointing towards that. And you also said that the new order, in fact, it is said that as a criticism of capitalism, those who oppose capitalism, they say that the greatest injustice is in the field of healthcare. And they also say, some economists say, that when this capitalist model will change, it will change most easily or modify most easily when the attack comes from healthcare. So maybe our sector might change or modify the entire capitalist paradigm to some extent. Great points. Thank you very much. Now, let me take a short break to ask you certain questions. And let me also say that the people who are listening to you are also thought leaders, as you will understand from the quality of the questions which are coming. So, first question from Mr. Vygon Mishra, who is the #1 consumer activist in the country. Vygon asks, why are private providers not collaborating with the government on universal health coverage under Ayushman Bharat or under the primary healthcare scheme? So this question is to Gautam and Navneet.
Okay, thank you, Pavan. I'll try and answer Mr. Mishra's question. So, Mr. Mishra, you know about this, that hospitals, the healthcare space is a full continuum from public, from a primary health center to secondary to tertiary to quaternary. And one of the objectives of universal health coverage is to get all the chains in this continuum to be functional as per its positional responsibilities. The issue is that if we want everybody to go to a tertiary care hospital and not fix the PHCs, we will have a problem on the too much load on the tertiary care. So there are two aspects to universal health coverage. First is to strengthen PHCs, and second is to figure out what kind of tertiary care facilities need to be supported by Ayushman. So many of the tertiary care hospitals, and you're talking about the hospitals, are experts in tertiary care. And that is why their focus is not so much on PHCs, and which is what the government's focus is today, and the GPs is the need of the hour. For tertiary care, the issue is if you look at the costs, for example, in a city like Mumbai or like we are there in metros, and there is a huge infrastructure and the equipment. So, like we say, healthcare is local. The pricing for healthcare is given in rupees, local, but you pay in dollars because you import 70-80% of your equipment and your salaries are high and your expenses are very high. So the pricing which is currently offered in the Ayushman scheme and the other government schemes, it does not match many of the expectations or actually costs of the tertiary care hospitals. There was a study done last year in which a large private tertiary care hospital clearly stated that the cost of a cardiac surgery in that hospital was 3 times the reimbursement being paid by Ayushman. So if that kind of a disparity is there, very difficult for those kind of hospitals to come forward. But the point is there are other hospitals in the country and many of them with low occupancies, with experts in smaller cities. I think it's a great opportunity for them to collaborate for Ayushman.
Okay, Navneet, anything you'd like to add here?
I think Gautam has more or less covered, exactly what he says, and you will also understand that private healthcare also, does a lot of these treats a lot of these panel patients like from ECHS, CGHS, from ESI, and has been doing it for a very, very long time. And this despite the fact that, over a period of time as inflation has increased and, costs have gone up, but the government has still kept the rates at, levels, as far as 2014, etc. And I think private healthcare has still supported all the endeavors of government in it. So, it is very right to say that private healthcare is as much a partner in Indian healthcare as the government is. And just to give a small, simile, around 70% of beds today are, in the healthcare space. I mean, the patient beds are by the private healthcare. And sometimes, also I am not here to sort of point fingers at government, etc. But, sometimes also private healthcare has been facing issues about, the owings which government has to pay them back. And, and you will understand that they're always faced with issues like working capital, cash flow, etc., etc. So, but I think of late what we have seen is there's a huge amount of collaboration. And this COVID is one of those situations in which we saw a dramatic, synergies between government and private, when they allowed the private labs to start testing, because they knew that without that, it will not be possible just for the government labs to test. So huge amount of synergies we have been seeing, understanding on the part of private healthcare of where the government stands, and understanding on government where the private healthcare starts. So I think it is just a start point. And going forward with a little bit of give and take, I think even Ayushman Bharat, when some of the reservations existed about pricing, etc., will be ironed out. And I see that it's a great step. Not only that, we have talked about this missing middle, so the poor get covered by Ayushman Bharat, the rich are able to pay, but the middle class always gets left behind. So there are talks now going out between the government and the private sector to synergize and to even get healthcare to the middle class, which is always forgotten. Thank you.
Yeah. So I think both of you, what you're saying is that healthcare is a sector, I'm sure you acknowledge, where you can do well and still do good, but you cannot feed from an empty vessel. And you are saying that if the vessel stays empty, the sustainability of the hospitals will come under question, which is why there has to be some kind of a compromise. I fully agree with you. And regarding the missing middle also, when NHS came, NHS became so successful and was accepted across the society also because in the World War II time, there were a lot of bombings which were happening. So all the people had to come together in bunkers, whether you were rich, middle class or poor. So the social distance, they merged. I mean, they dissolved, and which is why the upper classes and middle classes also accepted that, and their civic norms also changed. But now, with a lot of social distancing happening because of COVID, it will be really interesting to see whether the lower class also might say that they would like to maintain a lot of distance from any other patient, and which will also strain the hospital infrastructures, etc., in a way which we have not imagined. The other point is, right now, because of PPE as well as other aseptic procedures, and the and keeping your nurses, etc., in hotels, etc., the expenses have really gone up. So at this stage, the government, the industry is looking for help from the government rather than be able to partner financially in the scheme. The next question to Tony. Due to China factor, the government is now giving incentive to local industry of APIs to develop. Is there any guest in the forum who can help guide those people who might be interested in investing in APIs? Tony.
A very pertinent question, because it's not just COVID which has raised this flag of API overdependence. Number one, on imports, and more specifically 70% of the imports on China. This was raised in 2013-14 also, when the then government and the NSA actually raised a warning to the government that we are over depending on China and can be armed twisted. And that too in an area of healthcare which is so very sensitive to our citizens. That's when a committee was constituted under the expertise of Dr. Katoch. They submitted their initial findings, and there's been a draft policy which was actually released in 2017, pre-COVID, very much understanding the realization that we are over depending on a not so reliable ally, which is China. Coming to your point, yes, the government has initiated change, at least in thought process, is trying to incentivize more API production in India, but we have constraints of pollution norms, and we also have constraints of having actually given up API production more than a decade back because of the dependence on China, maybe because of the costs also. It's not going to be easy. It's going to take a couple of years. So 3 to 5 years is the minimum that I and the experts perceive will take us to come back on track to some level of acceptable dependency on API. It is a realization, but it may not be a reality very soon. But we must encourage this fact for the interest of the Indian pharma industry. Yes, Pavan.
Great. Thank you. And Siddharth, maybe you can share with the questioner the new policy which has come for supporting API, which also has huge grants in aid and other concessions which are going to be given to such investors.
One more
yeah,
point.
Go ahead, Sunil. Go ahead.
You mentioned is that so it's not only about getting the benefit of creating a sustainable model. What is also happening is that lots of other companies are now moving their API from China to India. So it's not only about catering to the Indian market. It's also about catering to the global market. Japan has now, in fact, come up with a $2.2 billion package for companies which are now moving their production facility out of China. Europeans will do the same. So India is going to see a significant attraction in terms of new capacities for API, both for local market as well as for the international non-China market.
Thank you, Sunil, which takes me to the next question and request. This is also for Siddharth, where the gentleman says that because US and other countries are withdrawing their facilities from China and planning to invest in India, and this is regarding, this is panning across the industries, what is the way to approach them? So Siddharth, you can help the gentleman reach out to your contacts in the embassies. Okay, coming to the next question, and this is to Dr. Harsh Mahajan. What will be the future for the IVD industry, Harsh?
See, this is dependent really on how much of testing is done. I think the future really for the IVD industry, even though it is intertwined with the destiny of the labs is still good. As we are seeing, only today we have seen that in Rajasthan, 10,000 kits for rapid antibody testing have turned out to be defective. And they say the results are 95% wrong. I don't know the details. This is what I just gathered before your session started. So I think this is a unique opportunity, just as for APIs, similarly for medtech, for making vaccines, actually developing them here, setting up the ancillary units here. So I would feel that the medtech has really a great opportunity, with even intellectual capital flowing in from outside. As Sunil said, there are these large international companies which now want to get out of China. And if we could have our own industry actually become resilient, become more proactive, and the government helping them do it, which the government seems to be wanting to do, I think a lot of the import that we do, as has been said, about 80% of medical stuff is imported from outside. We did not need to import PPEs. Now, just see what has happened is that within a matter of 4 weeks, we have thousands and lakhs of PPEs being produced in Gurgaon, in Noida, in south of India. So this, I think, is a unique opportunity, and which we need to grab and become actually the manufacturing hub, not just the hub which brings things together, but to innovate. Here we have such fantastic engineers, scientists. Also, I think this is an opportunity for software of a different kind, artificial intelligence, because we realize now that someone doesn't need to fly down from Gorakhpur to Delhi, wait in the OPD of a doctor for 4 hours, then see him for 5 minutes, and be told that this is the medicine you can have. This can all be done online. And also artificial intelligence tools, as you know, through our company Caring, we are working in this field for radiology, but similarly it can be, algorithms can be developed based on symptoms. It's able to give you an answer and help a doctor. And this could all be done online with our satellites in the air and our, cell phones being universally present. I think it's a great opportunity, and I'm sure, people will do very, very well. That's one sunrise sector, I feel, in healthcare.
Yes, and this sun is being thrown up by the Prime Minister's office also, because the PM himself is very keen on medical technology making in India. So that is another fillip which we are getting. And you're right. If you combine AI, IoT, blockchain, and big data, the opportunities which are arising are really phenomenal. They are as if a new order will be defined. And coming
just
to the
one point quickly, Pavan. One point, just to bring in some research which has been done for COVID. We work with IGIB. This is a CSIR institute in Delhi, Institute of Genomics and Biology, and they've developed a strip-based test which can actually, a patient himself, just like a pregnancy test, you can actually run a test for the virus, for the antigen. It's an antigen test which you can run sitting at home. This, they have already announced it. Now it is for, the medtech sector to come in and actually develop that. Similarly, developing, rapid antibody kits, developing RT-PCR kits, that has been done within the country. We just need to scale it up and bring in such good quality. China has got vilified, as you see, with the poor quality that it's sent out. And maybe in this urge to actually fulfill the needs of the global market, So that's another area, and our own institutes and scientists can actually pave the way. They don't need to go to the West to be able to do it.
Yeah, and continuing from the behavioral changes which Sunil spoke of, point of care testing of really very deep tests is the way forward, because more and more people would like to test themselves at home or with the minimal intervention from a phlebotomist and maybe a non-invasive test. So fully take your point. And coming to the next question, this is for Sunil. A rise in inquiries.
Pavan, can I just add one thing to
Yeah,
your...
please.
So what you talked about, the point of care test, I think the other important thing is it's very important for the hospitals. For hospitals to recover, it's important that they do the tests for patients before they enter the hospital, so that the existing patients and staff are reassured that the person entering into the hospital is COVID negative and is not going to infect the non-COVID patients. So I think it's a great opportunity. And there was a question, when will the sector revive? I think the sector's revival will be slow, and it will go in along with the development of these rapid tests.
No, very good point you have raised. You have mentioned. In fact, there have been cases where patients have kept their travel history secret. They've gone for a surgery. The doctor believed in them, and they conducted the surgery. And finally, the doctor got infected by the patient because he was a COVID carrier. So you're absolutely right. And regarding how much time it will take to recover also depends on these new things which will come, because one of the points which both Harsh and Sunil mentioned was that we do not know when will we be rid of COVID, because even if a vaccine comes, we are not sure how effective that vaccine would be. If the virus is extremely robust, it may possibly evade for some population the immunity which a vaccine guarantees. Harsh, you were saying something.
Yeah, I was just to take your point forward, what Gautam said about testing a patient before he gets admitted to the hospital. There's another reason for that, and that's for the patient's health itself. There is a series that has come out of China where they found that unsuspected patients who were taken in, they were not lying. They just didn't have symptoms. And these were during the early days of this pandemic. 34 patients underwent surgery, routine surgery, not emergency surgery. 34 of them underwent surgery, and 44% of them, nearly half of them, landed up in the ICU, and 20% of them died. So if someone is hiding, it is to his own peril. The doctor, of course, has to protect himself. And today, in a hospital, we treat anyone as a suspect COVID, and that's how we take precautions. But then even for the patient himself, it is a must that we test, especially when he is going into an ICU or going in for even a gallbladder surgery, a minor surgery, but he may die from it. That's crazy.
So Dr. Harsh, in addition to this, I think it is for us through this forum, we talk to the community at large, saying that you need to be truthful to save yourself, to save the other patients, also to save the hospital, because one patient who doesn't inform may result in quarantine of tens of 50, 90, 80, 90 people being quarantined from the hospital. So the hospital will be forced to close down or cut down its operations for the regular patients. So for society at large, it is important to be truthful and talk about this, because these are the values I think we need to show at this juncture.
Very good. And this will, I hope, bring in greater character and integrity in all of us, as well as promote technology which can discover lies and misrepresentation, not only by looking at our physiognomy, but also through issues like blockchain, through things like blockchain, etc., where the entire past history of travel, etc., is irreversibly recorded. So last question. Sunil, you were saying something?
No, so Pavan, I was about to say that, Arogya Setu is that first step in that direction.
Yeah, but that is where the privacy issues will come, because it should not be that because of things which we need to be doing more honestly, we start losing our freedom, and privacy loss means eventually freedom loss. So, but that's
See, this debate of privacy and population health management, will go on for a few more years, where
agreed.
until we find that equilibrium. But it's
We have,
government has no other option.
yeah.
You think for thrice before downloading it that ultimately I'm giving away my location, my everything. But that's a, in the interest of the nation and myself, it's best we do
So
it.
in French, there is an interesting word called sous-veillance. Sous-veillance means opposite of surveillance. It says, you survey me from the top, you survey me, and I will also look at you from bottom to keep you accountable. So that kind of a balance has to come in technology to make sure greater honesty as well as freedom prevails.
Yeah.
A question to you, Sunil. A rise in inquiries regarding medical insurance has been observed throughout the nation, but insurance policies are based on historical data. So will this affect the entire medical insurance policy system? Sunil?
No, I don't think it will have a big bearing on the policy, and especially in policy, the big question is around the pricing of the policy. So at some stage, what is happening today and the cost of treating the current pandemic will get factored in the historical cost as we move along. So after 1 year, this is going to get factored in. But I think increasing inquiries will not have any negative impact on the insurance. In fact, increasing inquiries and increasing policy holders should ideally lower the cost of insurance, because your claim ratio ideally should go down.
Okay. Last question, one other question has come, and I've tried to put the ones which I could not address in buckets which were in the neighborhood. So this is regarding how the cost, when the cost of hospitals has gone up, their ARPOB has come down, they have taken a big beating on their profits. How will they recover on the profit side? Navneet.
Yeah, thank you. This is a very interesting question, actually. I think, what hospitals are going to lose, and right now, I think we are looking at a Q1 almost lost, to be very fair with you, and with no guidance of Q2 at all right now. Historically, we have seen that most of these pandemics play out, but, two very, very different scenarios which have developed today, and many of you who have been following media and who have been listening to news. One is that crude is today trading negative. That means the sellers are willing to pay the buyers to take crude, and we have to understand this from where economy is heading and why this is such a very, very different kind of a pandemic, where crude oil never ever in the history has gone in a negative value, and today people are not ready to buy crude, and that is one thing that let's keep in mind. The second thing is the response of the governments. Now look at this paradigm shift between human life and economy. So the value of human life across the countries has become much more than it was in the previous pandemics. So countries have shifted economy to the back burner and said that it is human life which will drive the economy. What I'm coming to is, in the short run, the losses that the healthcare private institutions are going to make will not be recovered. There is no doubt in my mind about that. That are going to be gone, and it's going to be a sunk cost. How the future pans out is very interesting. I believe that slowly we will recover. Healthcare will recover, and as they say, that healthcare is one of the industries which will always remain vibrant. So, having said that, in the short run there will be losses and they will be not recovered. In the long run, hospital efficiencies and how the hospital models change. And if you remember, we had a seminar about an year back in which I have talked about changing the models of how healthcare exists today. And I think it will give that opportunity to the healthcare players today to change the basic models on which healthcare is being delivered today. And that, I think, once comes into play, we'll be able to take care of what we have lost today, which I think will not be recovered, and change the way healthcare is delivered in the future.
Very good. So healthcare was till recently accused of making invention the mother of necessity. They invented something and then they popularized it, and then it was used by many or on many. Now again you are saying that necessity has again become the mother of invention, and now it is very important for the hospital sector to innovate and find new models through which it can sustain maybe less profitably, but still sustain and grow. Any last comments from the any panelist? And otherwise, yeah, Gautam.
I was going to add to Navneet's points. I think what he talked about financials, so I'm not going to talk about that. He's covered in detail. But I think what is important for the hospitals to realize, to just reassess the priorities of a hospital, what they are in for. Because I think it's a time to think what is the right thing to be done. For example, whether expansion versus consolidation, whether financial models, whether you want to leverage with debt or you want to grow slowly with your own funds. And I think most important thing will be for all the healthcare leaders is to just do the right thing, because at this point in time, the losses have happened. You can't recover it. But if you do the right thing, I think future will be good for the hospitals and good for the society. And maybe that's the lesson we need to learn from the pandemic.
Very good. I think what you're saying is after the fast, don't think of feasting. Try to do the right thing. And don't try to recover what cannot be recovered. Move in the right mode forward. We have got a compliment from Vygon Mishra. Okay. Last point, Tony, you raised your hand.
Yeah, I wanted to do a reality check on healthcare and the socio-economic shift that has taken place. Basically, the world order has changed because of COVID pandemic. And the way people, including me and all of us, look at healthcare and fitness is going to be very different from yesterday. While healthcare and fitness was probably, down the priority 3rd, 4th, or 5th, I'm pretty sure on most of our list, it is going to move to the number 1 position, including the governments across the world. And therefore, the way the healthcare industry is going to respond to this prioritized need is going to be very different from the past. Coming to the reality check that I wanted to make on the sub-segment of pharmaceuticals and healthcare, pharma has also taken a beating. Like we just heard the other panelists talk about their segments. While we do not have any visibility on the end of COVID today, there's no horizon that we can see. As of now, we talk of half of March, whole of April, and probably part of May already. 2 months have been erased from the operational cycle of the pharmaceutical companies. But those 2 months have not been erased from the financial cycle or the calendar. And pharma industry is a human resource intensive industry. The fixed costs even here are pretty high. So you're talking of 2 months of non-operational revenues, but 2 months of fixed costs which have come in. So that's going to be a permanent and that's going to be a hit. I am not too sure whether that can be recovered because the entire cycle have been pushed ahead by around 2 months. We are hoping that the entire cycle will regularize faster in healthcare, like all of us have been talking about. But we need to see the visibility of the end of COVID very soon. Dr. Mahajan and a couple of us spoke about we having flattened the curve. But the expert virologists and immunologists talk about acquired immunity and the immunity which is adaptive and adaptive immunity. So till around 70 to 80% of the Indian population is not exposed to the virus, either through direct exposure or induced exposure by vaccines which are more than a year away, the threat of COVID-19 is going to be alive. So how far and how soon are we going to be getting rid of this COVID-19? Let's hope it's sooner than later.
So I'm glad that as a professional, you have said that these 2 months should be erased from the P&Ls. I hope as a shareholder, you will also think like, that. And I hope that the taxman also will think like that. So
just
on
one point that I think is very important to raise. While you said it on a lighter side, let's hope it becomes a reality. In pharma, I'd like to segregate the segments of chronic versus acute. I think Dr. Mahajan raised that point. See, the acute industry, chronic industry, let's go to that. You talk of cardiovasculars, diabetes, neuro, nephro, and the like, where the patient has to take medicine for lifelong. That actually has been a panic purchase in the month of March. And there's been a spike in the growth of that subsegment of chronic, which is actually an artificial and false spike. In acute therapy, because the patients have not reached the OPDs or the clinics of doctors, there has been a dip. So the impact of the growth, the negative impact probably will get seen in April and May, whereas the chronic segment will continue because those are the repurchases. The new chronic patients may not get added, but the old patients will continue to buy their medication. So I thought that clarification was important.
No, very good point. And using that vocabulary, sorry, somebody wants to say something?
Yeah, Pavan, I just wanted to make one quick point.
Go ahead.
There's going to be a big learning from this pandemic, which we haven't learned from the ones that we just had in the last 2 decades, is that we need to plan and build our hospitals differently to be ready for the next pandemic, and in such a manner that the non-infected people do not suffer. They are suffering right now, in silence. They are not able to come to hospitals. If we had planned hospitals that there was a highly infectious wing and the rest, probably they would not all be at home.
No, very good point. And I think those investors who are listening must be noting these observations which you are making. And I'm sure Sunil is also noting. Talking about that vocabulary of acute and chronic. So what I think the whole panel agrees is that the healthcare industry has also got an acute blow. But in the chronic, or let me say long term, we feel that we will recover. And with greater innovations, which are more aligned with the socio-economic and behavioral grain, which will evolve going forward. On this note, I pass it on to Siddharth for any last words or any last question. And thank you.
Pavan, can I make one intervention here, if you don't mind?
Go ahead.
I think there's one major government structural change that is required. And we made it pretty belatedly in the defense sector. Most of the Western governments have a chief of defense staff. In India, we did it only last year. In fact, from the 1st Jan 2020, to integrate the overall hybrid operational efficiency of the 3 forces of Army, Air Force, and the Navy. We also started something like this in the National Disaster Management, where our overall response has improved. Virology, viruses, and bacterial and pandemics are going to remain. They are the order of the day. They have been coming, they have been going, and the new viruses will come. I think it's high time as a government, as a country, we also evolve and institute a combined action force, which can integrate the responses of the center, the state, and all other departments, and create something like a national pandemic response mechanism board or something. So that's very important.
No, very well made point. Tony, please switch on your video. Yeah, go ahead, Sunil.
Sorry, Pavan, just one bit.
No, go ahead. I think, see, the audience is hooked. They are listening. They are really finding your point. I was just told that the number is still more than 100. Okay, go ahead, please.
That's very encouraging. So I'll just take a cue from what Tony said, with bit of a difference that the moment we start coming out of this pandemic, healthcare is going to occupy the largest mind share of any government, and the government will look to make some big changes in the sector. And I guess all of us in the private sector, and I would include the entire component of healthcare, not only as service providers or product companies, should come together and represent the industry in the right way, so that one segment doesn't suffer at the cost of the other one. So the more proactive we are it's like getting into a self-regulatory mode of how, as citizens, should we respond to these kind of situations, and proactively approach the government in any, preempting any significant policy changes that may have a negative impact on private sector or attracting private capital.
So to make sure that all the various subsectors of healthcare are well represented, I request Siddharth to make a gist of the suggestions which have come, and also interact with the panelists and other participants once again to draft something and send it as a collective voice to the government regarding what is our advice for future. Yeah, Siddharth.
Sir, this has been a highly insightful discussion. I've been getting messages from the attendees personally that they really appreciate all the various voices and the various insights which we've got from this. Rest assured that we will package this video and summarize it well through our publication, which will be disseminated and reach to all those who matter and all those who are willing to learn from this. So also a lot of people who have more comments are coming in. If required, I'll possibly reach out to you individually and then take it further. So thank you very much, sirs. It's been an absolute privilege to have you all, and look forward to more such industry discussions. Thank you.
Thank you very much, everybody. Bye.
Bye.
Thank you so much. Thank you.
Bye. Bye. Bye.
Thank you.